I just loved that interview.
Yeah.
I love Dr. Franco.
I think, I had a feeling. I kind of had a big feeling that was going to be worth.
I loved that you brought up online dating.
Yeah.
And like to a doctor and and I love what he had to say about it.
Fuck yeah.
About his nurse who is just dating multiple people. You know, it is different times we're living in right now.
Yeah, no, I mean, seriously, recently I got invited to a gathering.
Did you really?
Uh-huh. It was only going to be like 5 people. I swear to God, everybody's been quarantined for 2 weeks. Just like,
Damn.
And I know 2 of them. I know 2 of them hoes are on that grinder and scruff stuff and running amok, because that's the thing. Listen, there's sex addicts out there. There's drug addicts out there.
Yeah.
You think they're stopping what they're doing? They're not.
No,
they're not. So let's just keep it real.
And then there's just some of us that are just flippant, you know? And
Yes.
when I first saw, have you seen those? I feel so bad for them now. Those kids that were in Miami in spring break. There's like that one kid whose face got plastered everywhere. But you know what? Look, is he an idiot? Of course. But were we all kind of idiots? And like, have we all said stupid things? Yes. Who I really don't understand though, like they were like, we're kids, we want to party. They just don't know any better. I was mortified for their parents though. My mother would be mortified if that was me. What about the people like the Instagram influencers who were like licking toilet seats?
No, they're just looking for attention. I think their needs for attention and their need to like get likes and views, they should be banned from Instagram.
They should be. I got an alert that was like, kid sees woman lick toilet seat on an airplane. Nasty. And did it on a train here in, I think it was a subway train, licked the seat and then tested positive for COVID. Stop that shit.
Not even
You're
normal.
Like, this is not a joke. And like, sorry.
It's nuts. It's nuts. But yes, I do think that we're in it for the long run.
Yeah.
And I think that it is quite all right. A lot of us needed to take a seat anyway.
Yeah.
Truly. It's if you don't, okay, pick back up that guitar, girlfriend. If you don't learn a language, dojo language, right? There's just 100 ways to come out of this better.
Well, wait, are you going to love this? I'm sorry. Did I
go
cut
ahead.
you off?
No, not at all.
So do you remember OpenFit?
I do.
They sponsored us years ago when we had sponsors, which we don't do that anymore. So we can keep it real for you. I went back to their app and I've been doing their Yoga 52, which is like 1 class a week. They say, but they have a 14-day. So I've been doing it every day.
Okay, question, does our login still work?
It does. It does. It does. But I'm telling you, their yoga is like,
so
I've been
good.
doing it every day. Cause you know what? When this all happened, look, thank God we are not dealing with members of our family who are really sick. My heart goes out to you right now if that is your reality.
Seriously.
Because that is real. And for the rest of us who just have the great misfortune or great fortune of our own health and, you know, we're staying at home and trying to make the best of this situation. I was like, how can I come out of this better? Right? How can I take this time and look at it as a way to sort of reconnect and come out? Like you said, learn the guitar, learn a thing. Tom and I started running in the park because I was like, I've always kind of wanted to be one of these people when we got the okay from our doctor and clearance.
Of course.
And it's just 1 hour a day. We go out, we do our run, and we come right back in. But it's nice. And then open foot yoga.
I knew that you. I knew that you guys were like evolving because you were a little quiet. And then one day you were doing yoga and I was like, who? You? Hold on. You? Come on, girl. I've known you a long time. You've never done that.
I do yoga occasionally, but not like every day. It is like
amazing. So Oprah and Deepak Chopra have started a really beautiful thing for people who have never meditated.
Okay.
And never done that journey. And I have a couple of people in my life that need that. So it was a beautiful thing to kind of pay forward, because at this time, I think people are just unable to figure out what's going to make them feel better, because
Yeah.
it's definitely unraveling because we have no control. And you will reach for that thing you never did before, or possibly went, really?
Yeah.
About. Because when you see the people that are still Zen going through this, they had the upper hand if they were tapped into their inner core self to begin with.
It is so true. And I love right now that telemedicine, I had an appointment with my doctor on telemedicine, and that all of these virtual appointments and technology is really allowing us to connect, to have our lives still move forward with at least a semblance of normalcy,
Yes.
and that it could be something that like really changes the way that medicine occurs. Also dating too.
But question, before you get to what you're getting to, would you do a skin check via telemedicine?
I mean, yeah. Listen, right now, are you kidding me? For sure. With Jabber? Of course I would, because we got to keep it up right now. And skin cancer is one of those things, man. You know, it's if you catch it, an ounce of prevention, it could save your life. So,
Very easily,
yeah.
very, very easily. So do not skip that skin check, no
No,
matter what.
and you know what? You got to do it. I don't know. We should get a dermatologist on and see how they're doing those. But certainly, like taking a picture and sending it, as you're going to hear later in this interview, I didn't realize that there's HIPAA safe apps so that you can know that you're sending the picture, whether it's a mole or whether it's your 40-year-old breasts that you want picked up and you don't want your dad to see.
Or
You
your
can send it safely,
proctologist,
or your
or,
butthole.
or your butthole. You're
Right.
good.
You're good.
Keeping it real. This is the life we live, and this
Mhm,
is where
mhm.
we're at. So don't be afraid, because I can't believe there's HIPAA that's
Yeah.
amazing.
And so, yeah. Mhm. And look, if you're looking to have a virtual consultation right now, you're going to want to tune into this interview. We had Dr. Johnny Franco. He is the founder of A More Beautiful You Plastic Surgery in Austin, Texas. And he's got some awesome things to say, and really wonderful insight on this whole new-ish world of telemedicine. But first, he told us a little bit about what's going on in Austin, which was kind of surprising.
Videos of like we have a Barton Springs, this natural pool that's super popular in like central Austin, and it's like standing room only. So people took the day off and everybody went to the pool, and it's just like wah wah.
You know, we that happened. So it was like the first Saturday of work from home was beautiful here in New York. And when I went to Central Park, and people, it looked like business as usual. I live in a very residential neighborhood of New York City. So I think that Midtown seems, and when people see, online, they see pictures of New York, it's like Times Square. Well, Times Square
Hmm.
is business. So it looks empty as can be because everyone's working from home. But Central Park looked like business as usual. And they really had to shut that down because, they were like, stop playing basketball,
Yeah.
stop having your kids play on the playground with each other. Like, this is serious.
No, they were showing people having picnics. It's like putting their blankets together, and I'm
Yeah,
like,
yeah. You
seems
know,
like a
it's
big deal.
Crazy.
Yeah,
it's it's tough times. But thank you, Dr. Franco, for joining us.
I appreciate you having me.
How are things there in Austin other than, you
Things
know
overall are good. I mean, I think spirits overall are high. Austin is very different than the rest of Texas. It's very like keep it weird. It's very like in terms of like overall Texas is very conservative, but Austin's very liberal. So I think if it was up to the people in Austin, they would have done a shelter in place since like November. Uh,
right? They've been sheltering in place forever, right?
they have, and so they've accepted it. I think a lot better than other parts of the state. My friends in Houston and Dallas said people have not taken it as well.
Really? You would think
Yeah.
that they would do that there.
Um, I think some of it just comes from uh, Texas has its own. You know, every year they file a petition to make it its own country, And
Right.
so, a lot of them just don't want to be told what to do by anybody.
God bless you, Texas. God bless. I
I
mean,
mean, it was toilet paper, guns, and ammo were the three things that sold out. And it's
but
And
like
if we
worldwide, it was scary. Yeah.
frightening,
Right.
and if you talk to any of the banks, I'm sure a lot of cash was pulled as well.
oh
Hmm.
yeah. Oh yeah.
Oh, hmm,
And a lot of them are the essential business, but a lot of them are working from home. So, if you didn't do stuff early, it's slow to make moves.
Yeah.
yeah.
We have, for really like the past year and a half, had this podcast that celebrates a lot of like the luxuries in life. We talk about plastic surgery, we talk about expensive luxury beauty items, and I think now, at least in the time being, right now, once we get through this, public health crisis, the economy is hopefully going to bounce back, but it could take a while. There's a lot of people right now who are hurting. Um, and so, keeping that in mind, I still wanted to talk to you about, there was a lot of people right before the coronavirus who probably had procedures, whether they were cosmetic
Mhm,
or not. And, something that people weren't thinking about was like, how do I now keep up with like my post surgery follow ups?
mhm.
I got an email from somebody when this first started happening saying, I was just told I need to work from home. Is it a good time to go to my plastic surgeon? I've been thinking about having a little work done since I've got to be at home anyway. And listen, at that time, that didn't seem like the dumbest idea, right? It's like, okay, I've got to take advantage. I don't think anybody knew. Things are changing minute by minute. I don't think anybody 2 weeks ago thought that this was going to be what it is. But for those people who need to keep up with telemedicine and virtual appointments, like how does that work?
I think there's you hit on probably like 16 good points there. And
Oh,
so
good. Sorry,
I
somebody should
mean,
have shut me up.
because the very first part about backtracking a month ago, if you don't mind, I'll kind of go in like
Yeah,
chronological order here. Going back a month ago, there was a lot of this. I think most people knew something was coming. I don't think anybody knew exactly when and where and what. And so, to your point, we had a lot of people who, some people who wanted to reschedule or push their surgeries back, but we had more people trying to move their surgeries up because they had time off, they could work from home, they could do something else, and they had that time. And I think a lot of people felt that at some point there was going to be some shutdown, some distancing, some something. And so, no question, the first part was kind of the craziness of trying to accommodate everybody's schedule, and we kind of did whatever people wanted as much as we could accommodate. If people wanted to reschedule their surgeries in these crazy times, we waived any rescheduling, cancellation fees, those type of things to try and do our part. Obviously, there's a limit to how many people we can move up and
right.
safely do in a day and time and what the surgery centers can accommodate. And then to your point about what happens now to all the people who had surgeries, and if you don't mind, I'll just touch on it really quick. Here in the state of Texas, there's actually an executive order from the governor that no surgeries can be performed till April 21st unless it's an emergent, and obviously very few cosmetic elective surgeries fall into that category unless you had some type of hematoma take back or something to that
Right.
effect. So they've taken it very seriously here. For anyone under the medical board, physicians, anesthesia nurses, they will suspend licenses if they're
Yeah.
performing surgeries.
Well, and you know what? In all fairness, it's because I think for a number of things that we don't, although people probably now think about them, but it's, number one, they need that PPE, that personal
Hmm.
protective equipment in scarce supply right now. So I think, to be using it to get your Botox when somebody needs it to save their lives, we can all see that. But then there's also like, what happens if something goes wrong, right? Things go wrong, and the hospitals right now can't support that. And originally, when this all started happening, again, things have been changing minute by minute. Was talking to a doctor who was like, "Yeah, we're still going to do some stuff. We have our own facility," and I was going to interview him about that. And then he called and he's like, "Nope, that New York State has also forbid any non emergency surgeries from happening. I can't even go to the dentist right now."
No,
Um, yeah,
I typically tell people there's four reasons why it got put on hold. You hit on two of them. One is trying to to protect whatever equipment and gear people have. It's very hard to get. A lot of plastic surgeons, and including us and a few other practices, have donated extra stuff
Yeah.
that we can have to the hospital, and that's been around the country. So they've done a great job with that. You could never anticipate what's going to happen. And so even though, like here in Austin, there's not a shortage at the hospital now, we don't know a week from now. And if somebody has a problem a week or two from now, we want to make sure that we're on the downslope of that curve before we put anybody into a bad spot. I think people also don't realize, as part of doing our part of not, of limiting this community spread, because even if you bring somebody to the surgery center, they still need somebody with them to help them. They're going to
Yeah.
Walgreens to get prescriptions.
Yeah.
They're coming into the office. Somebody's coming in to check on them. And I think people don't realize how many people are involved in your care for just your single surgery. And
Right.
so there's just a lot of factors. And the other thing, even from private surgery centers, here in Texas, there's an order where if the state needed, they could come into a private surgery center and borrow, in quotation marks, ventilators, breathing machines, any equipment. And it's some of my friends that have their own private surgery center. This has already happened where they've come in and borrowed supplies.
Wow.
Yeah.
Oh, it is
Crazy.
crazy times. But with the surgeons and with people who have to come in now for or have not come in but have post surgical follow-ups, are you allowed in Austin to still come into an office or no?
You are allowed to still come into to an office here in Austin if you're considered essential, and essential is basically any healthcare. So we still have our office open to a degree, and the reason is this. And so we still, I would say probably 70% of our team still works from home or works remotely nowadays with EMR. With we have like an electronic phone system, we can forward stuff, so we limit people moving. But the problem is, if you just shut your doors, all the people that you've operated and taken care of still need care somewhere.
Yeah.
And we had that happen today. Someone had a surgery at some outside facility practice that's just closed, and they were trying to find a place to be seen. And the problem is, if you close your doors completely, those people are going to need care somewhere. Now you've punted that down the road to the emergency room, urgent cares that don't have any extra space, and a lot of them just need to be triaged. So actually, 90% of our appointments are just online virtual appointments. So we have
Mhm.
a skeleton crew in the office just in case for the couple of people that do need to be seen. If they have a drain that needs to be taken out or just something they're completely worried about, we'd rather them come to our office than inundate an urgent care or emergency room that can't handle any more people.
Right.
So trying to do our part. It's been absolutely surprising how receptive people have been to online virtual appointments. They have been extremely. It's almost the flip side is people aren't going to want to come into the office when they're done, because they're like, I'm in my PJs. I don't even have pants on. I got my scrub top and they're ready to go.
So I had to follow up. My husband and I got sick when all of this started. Long story
Hmm.
longer, we lost our sense of smell and taste. And I had to have this telemedicine because then they found out that it could be a symptom of this. Look, without a
Hmm.
test, what we've said before, without a test, you just don't know.
Correct.
That said, we made sure to self isolate so we weren't spreading it just in case. But I had this telemedicine phone call, so I was booked it online with my PCP, my primary care,
Hmm.
who I love. I love that he like did it. It was super seamless. I got a same day appointment, and I was like, "How is this going to work? Are we going to Zoom? Are we going to Skype?" And he was like, "No, we're going to call." And at 12:30, right at my appointment time, I got a call from him, and it was like, "Wham, bam, thank you." So convenient, so reassuring. And I just thought, man, I didn't have to schlep downtown for 45 minutes, wait in a waiting room for 10.
Hmm.
He's pretty good with his waiting room. Then schlep back up down. You're right. People are not going to want to go back to the way it was.
And I think the one thing people aren't seeing is, even though we're going to get over this hump, this idea that we're going to go back to where we were, in January, I mean, that's 6 months, a year away, unless there's some type of vaccine or something comes, because you can't put 30 people in a waiting room, even when we feel like we're better. And so I think that some of these rules about the number of people in offices, limitations are going to be, and I think we're going to still have to do a pretty good job of triaging who needs to be seen, who doesn't, in terms of that. But you're right, for the vast, especially for plastic surgery, someone who has a breast aug. We see them in person the next day. And even when this was getting closer, we told people there's going to be some virtual follow ups. And so the next one, most of the time, it's like, hey, can I do this? Can I start working out? And so they have their list of 5, 7 questions, but again, it's a 10-minute phone call. They didn't have to drive. They didn't have to get somebody to drive them if they're still
Mhm.
not in a good spot to drive. And so the convenience of the people have been like, wow, this was not bad.
I mean, do you feel like as a medical professional that are you doing most of your appointments via video or phone?
We do mostly via video, and we
Okay.
were doing virtual appointments and online for years because we actually 70% of our practice comes from outside of Austin. And so if you
Wow.
think about Texas being such a bbig state, again, to your point, a 30-minute appointment may be a 6, 7 hour round trip for somebody that lives way out in West
Yeah.
Texas. They drive 4 hours there for a 30-minute appointment and 4 hours back. So it was 30 minutes of my time, but almost 9 hours of their day. And so for them, this has been super popular. We do most of them for video. We have a plastic surgery app, and ours is a little different just because we do try and get people to send pictures ahead of time. I
Mm.
think for our patients, it's much more comfortable to have your significant other or put your phone on a timer, take a picture, upload that, than be on a some type of video chat and then have to undress or do things like that. And I think that way it's a much more comfortable situation.
I was just going to ask you, are people just like, first of all, I would wonder, like, is this hackable? Could this someday, am I going to see my
That's
tatas?
but and that's and
Or
that's some
worse, is my dad? Like,
Good
and that's
point.
why
right?
no, and that's why being very careful about it and how you do it. And there's a lot of HIPAA secure systems out there, and
Great.
Zoom can actually be
So
said.
many.
We have our EMR is actually already has a telemedicine built into it that's HIPAA secure, and so people actually love it because it's a separate app just like anything else on your phone. And when they first get to the program, they take their information. They actually get a text that has the link to the app. They upload it. They can actually text message securely through the app with us. They can upload their pictures. They can do videos. So even before this happened, a lot of people, maybe the next open appointment to see us isn't for another week, but they can upload their picture. I'll be in the middle, I'll be in surgery, and in between, one of the nurses will be like, hey, so and so has a question. They sent you through the app. I'll look at the app and be like, oh, yep, video looks great. They're fine. Or no, let's have them come in tomorrow. And it has made stuff a lot easier for us.
Wow.
Definitely. I have to say, okay, so I definitely Skyped with my hair restoration guy,
Okay.
surgeon. I definitely Skyped Amber Pre with the proctologist I've been telling you about. That
Oh.
was hilarious. Um, Never thought to ask,
I hope he
is
doesn't ask for pictures.
oh, well, no, he didn't. I'm not that shy. So I want to shift a quick combo because I want your opinion, doctor, because this is
Sure.
kind of like, this is real. This is real time. This is real
Mhm.
life. This is our new normal. How about all the single people that are dating on dating apps and or hooking up? How crazy is that entire world to shut down? And how scary would that be if they don't?
Well,
Think
I
about
think
it.
no, I think it's been a couple things. One, I don't think people have shut down as much as they'd like. One of our nurses who actually does a lot of online dating said that she's actually loved this because she can go on like 4 dates in a night because she'll schedule her 20 or 30-minute FaceTime date and then moves on to the next,
Smart.
and then and she's like, and I was like, at that pace, you're gonna run out of people to date. There's only 1 million here in Austin.
Oh
And
my
she
gosh.
and she goes, no, don't worry. With people being cooped up in houses together, there's gonna be a lot of single people come in 3 months.
Oh, she is correct. She's correct on that. I
I
can't
saw
believe it.
there was a great social media meme that was like, hey, shout out to all those jerk guys who are now having to self quarantine alone because you ghosted all of the women in New York City.
I I honestly think this is a huge window of opportunity, because doing the video chatting, doing other things, it's a less like backing up to that point about the online dating stuff, I think this is going to change medicine forever. I think the time right now is obviously a horrible crisis, but it's going to push us because we've talked about doing more telemedicine. We've talked about making more access. And I don't think we see the other sides besides getting your breast done and not having to drive 9 hours for a breast dog. Like, I get that. But there's the flip side of specialists. There's only so many specialists if you need a specific spine surgery or foot and ankle. There's only so many ortho ankle specialists for certain injuries. And the bigger the states, these rural communities, it's hard. And if you think about it, if we push ourselves to get better at this, the access and care, the amount of people that we can see, like it's definitely, I've taken a lot of the credit in our community for being ahead of this, but really our staff is amazing because they line up this. They're the ones who walk patients through the apps. They're the ones who make sure all the pictures get uploaded. So our time is super focused when I'm with them and makes that a good experience.
Wow.
We're lucky because we use Zoom, and we've been using
Mhm.
Zoom for a while now to do our podcast. And so,
You guys are ahead of the podcast game.
oh, thanks.
We,
Thank you.
yes, we are.
But when I needed to go into my 9 to 5 job and they were like, how are we going to do that? I'm like, no, Zoom. And everybody was like, no, no, no. I'm like, trust me on this. It's easy. And once you get it to work, I don't believe now that we're going to be in this society of like only work from home. I think people
Mm-mm.
still are going to need that face to face. But I do think that this has forced people into this world of telecommunication and virtual communication and or what would it be, virtual remote communication.
Mhm.
And I do think that'll be sticking. And I love hearing that you're like more doctors, because it's not just in a state or in the country, like it's worldwide.
Mhm.
It is. It
It
is.
it
Are you familiar with One Medical, Amber, in New York?
I've heard about them. Yeah,
Are
that's
they
like a
are
new.
they are they
We,
near you, doctor, as well? Have they come down
I'm
there?
I'm not familiar with them.
So One Medical, they're in New York, they're in DC, they're in Boston, which is why I joined them 3 years ago when I moved. I can literally log on to their app. I can have within 5 minutes speak to a nurse. Within 5 minutes, I can teleconference with a nurse, tell her my symptoms, see if I need to come in, see if I need to write it out. What's the gist? Like, what's going on? Like, how bad's the flu this year? I'm doing it from my bed where I feel like
yeah,
shit. And I have been doing, they were they were one of the first people to ever get ahead of that. So I've been doing that for a couple of years. Now, of course, I paid the premium to join the club. So, which
yeah. I
you
think
pay
it's
for
like
that technology.
150. They're running a special right now because I got something in the mail. Maybe it's $99. It's a monthly fee, right? And then you
It's
can.
a year. You pay that for the
Oh,
year.
for
I
the year.
believe, yeah, I pay $200 a year.
Oh,
But the amount of time that we all get to save, which means you get to see other people and help other people, it
right.
is a really great investment for everyone.
And
And
people. Oh,
to your
sorry.
point about the flu, that people don't realize how many work days, other stuff. So if you don't come into the office, if you're not driving, if you're not stopping at Starbucks on the way to the doctor's office, if you're not doing all these things, you're not exposing. And this is something that I
Everyone.
think lessons we're going to learn going forward in terms of doing this. And so the other thing,
Yes.
like here in the state of Texas, and I'm sure other states have, is it has pushed the state to push health carriers that they have to recognize telemedicine as a path to the future, and so that physicians' offices can be reimbursed for this, so that patients can do this through their insurance, can do this, and some of these rules have been forced, but I think some of this is going to stay in place, hopefully, and make that access easier for patients. So even those that don't have money and resources for these kind of exclusive membership stuff, even regular doctor office visits would start to play into this.
Right. And I know we got something from United Healthcare today, who is our insurance company, and they're offering it too. So it's something that everybody, if you're like, I don't know a doctor who offers this, you might want to call your
Mhm.
insurance company if you have insurance and
I
see
think
if they offer it.
CVS is even offering. I
Yeah.
think I walked out of CVS before this all hit and they jumped on the bandwagon. I believe they have that Instadoc in CVS and whatever they're calling that, forgive me, CVS. I love you, CVS.
Minute Clinic, right? Isn't it
Minute
the Minute
Clinic.
Mhm.
Clinic?
That's
Yes.
right.
There you go. Doc in a box. Pardon the phrase, doctor. But
I'm talking about.
forgive. That's just stick my foot in my mouth. Um, it's brilliant because when the way that you've discussed it today, it really truly is, it's taken one for the team is what it's doing. It's opening up space. It's letting doctors see more people. It's really truly paying it forward. So think about joining those. I
Do you
think that's
think
huge.
too people will also now be more respectful of well, and also like getting the flu shot? I get so angry with people who are like, no, I'm not getting it. And it's like, well, it's not just about you. If you get it, it's all the other people that you are going to infect and spread it to. And the flu is so deadly. I think people don't realize that. And then things like washing your hands. I was amazed to to learn in a very small office that I work in how many people don't wash their hands.
It's amazing some of the stuff that we have had to reiterate to people in terms of
Yeah.
washing hands. If you got 101 fever and you're coughing and sneezing, you shouldn't be in the office. You shouldn't be coming into contact with 16 people. I mean, it's a lot of this stuff was things that we learned as children, and at some point along the way, I think forgot.
Yeah. So if there's any bright side of this, it's that maybe some of the social etiquette around prevention and preventing spread and preventing other people from getting even just the common cold
Mhm.
will stick with us. And maybe some of this work from home, we can all see now that it might not be ideal and it might take a little getting used to, but that it works.
The one nice thing about when people are working from home is they've had time to do some online appointments with us for like new consultations, and we've done a
Oh,
lot of that in terms of the world of beauty. And while there's so much going on, it's kind of nice sometimes to dream about. It's like people saying once you go on a vacation, the first thing you should do when you come back is start planning your next one because that
oh
joy of
yeah.
knowing that you're going to have some outlet. And I feel like it's like that with plastic surgery and cosmetics. And even though you may say, hey, I'm not going to get my breast dog or my mommy makeover or my lips done until December. You know what? I might enjoy at least like talking about it, thinking about it. And the virtual appointments are another great way that here's 20 minutes where you can talk about it and logistically know. Because a lot of times people don't know how much time do I need off work? Do I need somebody to take care of me? How much is this going to cost? Like, is this something, well, maybe I don't get my tummy and breast. I just do my breast, but it's nice to have some of these open conversations and at least start planning, dreaming, and having a little positivity in the day.
Yeah,
Wow. Good point.
absolutely.
Oh man. This has been awesome. Is there anything else that you're hearing from your patients right now, that questions that are coming up that you feel like you want to address?
I definitely want patients to know that even though there's shelter in place, there's work from home order stuff, pretty much most of your physicians are still available in some fashion. And so, before you just run to the emergency room or ER, obviously, if you're feeling really bad or sick, obviously do that. But, if this is something that you would normally go to your regular physician about, reach out to them. They may have a screening program. Most offices at this point have implemented some type of telemedicine. And so, it's typically easier for a physician that already knows you to be able to help you than if you go to a urgent care ER where they don't know anything about you personally yet. And so reach out to them. Most practices at this point are doing have some type of telemedicine to help triage those calls and needs. So call them.
I love that you brought this up too, because there's a lot. It's a stressful time,
Mhm.
right? And I know when you can get in your head and get on the internet, and all of a sudden this little tickle in their throat
Mhm.
becomes, I've got, you're going to need like whatever. It just spirals out of
Mhm.
control.
Oh yeah.
And so also having like access to your doctor can relieve some of that stress.
It does, and it relieves the stress before it gets built up. And a patient we saw today, she said that she goes, "I've just had too much time on the internet, and I worked
Yeah.
myself up. I just
Yeah.
needed somebody to tell me that this is going to be okay."
Yeah.
Yep.
Well, thank
Yep.
you
And that's what
so
we're here
much for
for.
doing that. I really appreciate it. So, I mean, hopefully, do you have any predictions, any inside tips from the medical community of when we
Uh,
might expect?
I think it's going to be a while here in Texas. I'd be really surprised if we start any type of elective or non-urgent surgeries before May. I'd be surprised if we do anything before then. I think that what we're going to see is that it's going to be very regionalized. I think it's going to be certain areas that are going to be able to open up. I
Yeah.
think that it's really, really important for people to remember that there's no magic day where we're going to be like the sun's going to go down and come up the next day and be like, okay, we can resume to everything. It's going to be a long time, and it's going to be a slow phase in as we sort of slow phase into this. And I think for us, it's going to be an augmented surgery schedule, still limiting the number of people that come in through the office, and a very good mix of, you know, virtual appointments and people in the office themselves.
You know what? That's my husband's phone. If you can hear it, he is also working from home. So we are sharing this space that I normally have to
Love it.
myself on Friday.
Hi, Tom.
Hi. But, I do want to touch on also like the doctors, right? Because this has to be hard right now. We always think about this as a consumer, but for the doctors as well, who are losing all the revenue from people coming in and getting their Botox and all of these elective. How are you holding up with that?
That's an interesting point that I think people don't see from the flip side of this. And I'm on a group chat for the entire Texas Society of Plastic Surgeons. And it's interesting to see how people handle it. We have elected to keep everybody employed. And
Yeah.
so we have shifted hours a little bit, and trying to find things for them to do. So there's a lot of scanning and everything else, trying to find stuff for everybody to do. But I think it's really hard because with doing no surgery, seeing no new patients, now it's still floating the business for this entire time. And so I think nobody's worried about the 2 weeks. The problem becomes when, we if we're still not seeing patients in May or June,
Yeah.
how do you do this? And
Yeah.
so I
Can,
think some of the new bill stuff that's going to help with payroll and other things, hopefully
mhm.
will help support a lot of the small businesses, and not just ours. I mean, there's a lot of small businesses that have been affected, restaurants, other type things where, if takeout wasn't a big part of their business, um, it's
Yeah.
been hard.
Yeah.
Can I just flip side? What's the first thing to lose shelf life? Botox, filler? Like, is there a large shelf life on those things? If
There's
it
a large
does,
shelf life. There's a large shelf life. So usually it's about a year, 2 years, depending on,
okay,
on when you
cool.
got it. So it's pretty good. And most of the companies have been really good about reaching out and saying, hey, if you have any product that expires over this time, we'll
Yes.
replace it. And so I think that's been great. It's been nice that other partners have come in terms of helping with, in terms of uh, landlords have done stuff. We
Hmm.
have a building that we own, and we've offered some deferment to our other tenants over
Yeah.
this time to help them so that they can keep paying their employees instead of paying rent.
Black market. Black market surgeries. Is it around the corner?
Uh, it's already been some issue. To your point early in the time about some people want to do surgeries over these times. It's been an issue where there's been some clinics that have marketed doing surgeries even after the executive order was placed here in the state to
Wow.
not do surgeries, and most of them were not plastic surgeons. So their thought was, well, they don't have any control over me. They're not my board, so I'll do what I want to do. Um, it's
Hmm.
kind of unfortunate. I think now that the Texas Medical Board has made a statement instead of just the Society of Plastic Surgeons, I think it's a little bit different because one, if they're not even under the Texas Medical Board, they probably shouldn't be doing your procedure anyway.
No.
But two, they're that's why their things have come down very harsh. Is they're really trying to
Yeah,
put a
folks, you
kibosh
know
on it.
what? Like, just stay at
Yeah,
home. You got to
like,
put it
hold
off.
off. Hold
And
off.
and we never, not to make light of it, but like we get it. Like things like, your nails and your hair and your Botox and the boobs that I was also wanting to get. I've had them. I've been talking about them for a long time. So maybe we should talk.
Yeah.
But things wouldn't be shutting down like this. The world right now is shutting down. And when it first started, I admitted I was a little bit like, oh, I don't know, is this going to really be? But I said to somebody, look at what's going on in the world. People don't shut down. They wouldn't shut down the economy. They wouldn't have
No.
people separated from one another if it wasn't serious. So now is not the time to go break any
it,
And
rules.
and
it
buyer beware. you probably will not be covered by your insurance if something goes wrong. Think of the trickle effect that would happen if you did have a surgery during this time when you're not supposed to.
And not even your insurance covering it. What if you can't get a hospital bed? What if you can't get into an urgent care? What if you can't get a CT scan to see what's going on if you're having a problem?
And you also don't want to be in a hospital right now if you don't have to, because there's a good chance that you could be exposed to something.
And I remember all the pre-op stuff I have had to do pre-surgeries. And if you don't do those, I can't even imagine.
It's one of the things that we've talked about on our chats is how do we re-implement surgeries? Because one thought is, does everybody who's going to have surgery get tested ahead of time? Because if you're a young, healthy 20-year-old and you don't have any symptoms, as we know, part of the problem of the spread of this is not everybody shows symptoms. And so, but now you're under anesthesia and so forth, and there could be a problem. And right now it doesn't make sense to use up what limited testing kits we have for an elective surgery, to your point early on. So I think there's a lot of hurdles, and it's one of the things that we're working on is what's a safe protocol to reintroduce people, because there is a lot of steps to make sure this is safe and smooth for people. No question.
Got it.
Dr. Franco, thank you so much. You have been like a breath of fresh air. And
Seriously.
thank you, and to all the other medical professionals who donated ventilators, masks, gloves, all the PPE, beds, who've opened up their facilities. Even, I'm sure some haven't wanted to necessarily, but thank you from all of us. I love that we talked about dating.
Yeah.
Everything from dating to telemedicine.
No, it's so scary. And then those are the people that are at the just come over to my house party and have a cocktail. We're having 6 people over. Well, how many of you hoes been hooking up? I can't go. That's so crazy.
It's one of those things, because we've had people reach out like, why don't you guys do house calls or do this? And I was like, that doesn't make sense for me to go from one place to another, because now I'm taking whatever gets introduced in one house to another house to another house. And so to your point again, like it's just not worth it. I promise those wrinkles will go away when we come back. A tiny little line will be fine.
And guess what? There is a feature on Zoom where you can smooth all that stuff out. So since you can't get outside and see anybody anyway. Yeah, Ryan.
I'm gonna have to freshen up my Zoom skills. I didn't know about that.
There's a setting in there.
Not that either of you would need that. You guys look good. You guys are on point.
Oh, thanks.
This is I'm at ground zero. I'm definitely due for Botox and filler. This is full coverage makeup at its finest. I will absolutely tell you the truth. And maybe the Zoom setting too.
No, I think actually, to be honest, to keep it real, we took it off because we were like, you know what?
It was too blurry.
It was a little bit too blurry. But
anyway,
too awesome.
Doctor, thank you so much. Honestly, you kept it real, and we really appreciate that.
I appreciate you guys having me.
If people want to do a virtual appointment with you, how do they set that up?
Yeah, the couple easiest ways to get a hold of us. One, our Instagram. We do a lot of things talking about that. So
Instagram is awesome.
It's at Austin Plastic Surgeon, and so we show a lot of surgeries. I get on there. It's been another way that we've shared our information with people, just to be like, hey, this is what's going on today. Here's real time, because as you said earlier, stuff changes by the minute. And then our website, www.morebeautifulyou.com, is another way, and people can send in inquiries, and we'll get them scheduled and share some information.
Amazing. I have totally did a deep dive on your Instagram. It is awesome. I saw you with the woman's boob, and it was kind of whatever. We won't get into it. Awesome. Real stuff right there.
Appreciate it.
Really good information. Thank you again so much. If you guys want to ask us any questions, if you want us to pass anything along to Dr. Franco, listen, nothing is too big or too small right now. There is no dumb questions. Things are changing minute by minute. Reach out to us, hello@artbeautypodcast.com. We love to hear your thoughts. You can find us on Facebook and Instagram at Art Beauty Podcast. Sorry, at Art Beauty Podcast.
I'm sorry, Amber. And on YouTube at youtube.com/artbeauty. Like, subscribe, ask some questions there. Fill us in on how you're feeling. We would love to hear from you there as well. And always, we will see you next Tuesday.